We often discuss the responsibilities that we have as a nurse educator. We ultimately have a commitment to our students to make sure that we develop solid learning experiences for them to help align with our program outcomes, ultimately meet our program outcomes, to include their success in the nursing program and their progression semester to semester, and then ultimately to graduate and to pass the NCLEX exam. What we're going to talk about in today's snapshot is going to include some of the key elements that you want to prepare for as you think about the next steps on your journey towards CNE success. This is going to include faculty rights. So we talk a lot about responsibilities. So we're shifting our content to focus more on what are our rights? What are the elements of shared governance that are incorporated into the university or college setting? And how do we leverage our rights as we think about what our contracts look like and the decisions that we are making about our career? These are some considerations that you want to think about on your nurse educator journey. The goal of achieving nurse educator excellence is tied strongly to being successful on the CNE exam, and it's also tied closely to how much joy we have in our role. With so much turnover happening at the academic leadership level, it's more important than ever before to make solid decisions about the progression of our career. If you haven't already, we want you to go ahead and print out the study worksheet. This is going to help you stay focused as you move forward on your journey, whether that's to CNE, CHESI. Now that we offer that program at Dr. Sellars Educate, we do offer a CHESI prep program. Or maybe you are just wanting to learn more about the responsibilities and the rights that nurse educators have. So you've landed in the right place no matter where you are on your journey. And then the second resource we want you to pull out is Billings and Halstead. Now we're still in the 6th edition. For those of you that have been here before, you know why. But for those that are new, it's because the current exam is aligned with the 6th edition. However, the 7th edition is available, and feel free to pull that out if you have it as well. There is a crosswalk right here in the description that will also give you specific page numbers for the 7th edition that are aligned with the 6th edition. For the most part, if there's content that you can't locate, just reach out to us, info@drsellarseducate.com. All right, so there's 2 more steps we want you to take before we jump into our thought-provoking question and transition into our content. So first and foremost, we want you to go ahead and write down today's date, whatever date you're watching this snapshot. If you're watching it during our live premiere, then that's great. We want you to comment because we engage with our audience during our live premiere, as well as those that may leave a comment after we premiere this snapshot. We want to increase our engagement when we are even doing an asynchronous session, because you want students to walk away being clear about their takeaway points, which is goal number 2. We want you to write down, what is it that you want to learn from our time together today? Knowing that our focus really is around faculty rights, shared governance, and the role of mentoring and professional development, we want you to consider, what is it that you want to have a better understanding of after our time together today? All right, so we're going to go ahead and start with our thought-provoking question as you're writing down today's date and as you are thinking about what your next steps are going to be on your journey. We want to start with our thought-provoking question. If you haven't seen it already, we want to share it with you. We use Canva as our presentation format for those of you who are curious about what format we are using. All right, so here we go. The question is, how can nursing faculty best prepare for integrating interprofessional education into their teaching practices? So we have A, focus on meeting nursing specific accreditation standards and alignment with requirements. B, collaborate with non-nursing disciplines to develop shared curricula. Or C, maintain traditional lecture-based delivery methods to align with the nursing program's mission. All right, so I want you to think about 2 questions as you review this specific snapshot thought-provoking question. First of all, you want to think about, what is this question really asking me? We know that it's talking about IPE, but specifically it's talking about, how do I align my learning objectives and sometimes even the program outcomes with the content that I am teaching my students. Right. And then the second question we want you to consider is, what is it that I know for sure about content related to this question? Well, we know that this question is tied to facilitation of learning and socialization. So that's competency 2. And you want to consider, what is it that I know about interprofessional education? What content have I reviewed in Billings and Halstead and mapped to the actual nurse educator competencies that's going to help me narrow down at least to 2 options, and then hopefully you'll be able to choose the correct one. All right, so that's what I want you to think about right now. Go ahead and write down what your answer is. And then at the end of our time together in this snapshot, we will talk about the correct option and the rationale. With so many changes occurring in healthcare, it can be a challenge to stay up to speed on all of the changes that are happening in the clinical setting. Oftentimes, that's a big focus for us. Now we want to talk about what are those faculty rights that we have? Are we involved in making decisions about our nursing program? And what does Billings and Halstead and NLN Nurse Educator competencies say about our role in making decisions about our nursing program, even about the accreditation standards and how they align with the work that we're doing every day or the work that we want to do as we think about ways to revise our curriculum. Future proofing nursing education really is about us collaborating with our colleagues, looking at the evidence, and making a decision about how we move forward. So there are 3 critical elements that we're going to talk about in this snapshot. First of all, we're going to talk about faculty rights because those do exist. Second of all, we're going to talk about faculty appointment. What does that look like? How is it aligned with the nurse educator competencies, and what content in Billings and Halstead also is aligned with these concepts that we'll explore? And then last, we'll wrap up with faculty mentoring and professional development. How do we engage with other colleagues across the country and within our own institution to make sure that we are sharing information and not reinventing the wheel? All right, so first of all, we want you to turn to Billings and Halstead, page 4. This is where you're going to find information about content that we'll cover related to all 3 of these areas. And then we want you to also take a look at the blueprint that is included in the handbook. Okay, so if you want to take a look at your blueprint, let's go ahead and identify the competencies that align with the content that we'll cover today. So first of all is faculty rights. That's going to align with content in competency 7. Faculty appointment is going to align most closely with competency 6, pursuing continuous quality improvement. And then faculty mentoring and professional development is going to align most closely with competency 8, functioning as a change agent and leader. And if you haven't already figured it out, you probably realize that, these competencies really do align with several different elements that we're talking about. And you're absolutely right. They do cross over nicely. However, this is just a starting point as you think about what your focus is going to be on your nurse educator certification journey, or if you just want to become a better nurse educator. So when we talk about faculty rights, Billings and Halstead specifically identifies the role of shared governance. So it's exactly what it says. For many of us, this started in the acute care setting that may have been a magnet designated hospital, or you may be familiar with the magnet standards. It is our ability to be involved in those decisions that are made, where we are able to share our thoughts, to sometimes even share what the literature says about decisions that we made, how we govern, how we run, how we manage, how we lead our nursing program. We also want to include our students. When we talk about faculty rights, we also want to incorporate the student elements associated with our rights and responsibilities. I'll give you an example. When it comes to our curriculum meetings and our specialty meetings, we actually invite students to those meetings. Okay, so even though you may feel like, well, that's really not aligned with the faculty right, it is aligned with shared governance and our ability to gather feedback and to engage students at the table when we're discussing the nursing program. And then next, we want to talk about institutional decision making. This is at a higher level. So, shared governance, we want to incorporate within our nursing program, but we also want to spread that out beyond just nursing into the institutional level. We want to have a seat at the table. We want to be involved as we move forward with the mapping of our essentials, as an example, to help our colleagues across the university understand the dynamics, the ever changing dynamics of the nursing education curriculum. And then we also want to explore competency based, as an example, curriculum. We know that competency based is not only for nursing. In fact, it's not even a new framework. It started long ago, and we want to make sure that we are sharing with our colleagues all of the changes that we're moving forward in the nursing program. And then academic freedom, our ability to engage in not only conversation, but to make decisions about how our work will be shared, how our work or how we are responsible for protecting our intellectual property, and then how much responsibility and ultimately freedom do we have to make changes in our curriculum, to make changes in the actual courses that we're teaching, and even the evaluation tools. Okay, so these are all considerations. We talk about faculty rights, that you want to go back, take a look at your institution, and decide where there are opportunities, or maybe you're right on track. So you can check this off of your, or mark this off of your to-do list if you're already well aligned with these standards that we are discussing. Faculty appointment, three important considerations we want you to remember. First of all is transparency. Let's have clear policies about the actual process that is associated with faculty appointment. We talk about tenure track and promotion, making sure that we have specific rubric criteria that is objective in defining what is required for our colleagues to be promoted and to achieve tenure. And then what is that promotion process? Not only within the nursing program, but also at the university level. What does that trajectory look like? And then this is another important element that we have to remember. What support do I have available to me from day one? Just like with our nursing students, we want them to understand the expectations for the entire nursing program. When we're mapping out our nurse educator career journey, it can be overwhelming at first because we know we have to be a really good teacher in the classroom, but there's also a service component and there is also a scholarship component. So, how do we ensure that we are managing and really balancing all three? Well, that's going to require us to advocate for ourselves and to speak up about what we want our nurse educator journey to look like. So, having a clearly defined promotion process is a really important part of the process. And then the other point I will make is that sometimes we may not be clear about what our process should look like. This is going to be a great opportunity for us to reach out to our colleagues when it comes to professional development opportunities, whether that's conferences, or if you have in-house within your institution, faculty development or professional development department. It's a great chance for you to give them feedback about some opportunities that you want to add as part of the curriculum offerings that they may provide for faculty. So, mentoring is actually going to cultivate our ability to use evidence based practices in the classroom. It cultivates retention and recruitment because how many of us are excited when we join a university and we have a mentor assigned to us, or we may have several mentors? I want to give you an example. If we're on the journey for writing a publication, and it's our first time, it's a great opportunity to have a mentor who has published several articles or maybe presented at a conference. They have expertise in developing that abstract and for being successful in having their work accepted, okay, or fully published. And then the skills that mentoring actually fosters, not only for us as a mentor, but also for our mentee. We're able to role model these great practices of what's required to help support our next generation of nurse educators. And then Malcolm Knowles' adult learning theory, right? When we think about our commitment to lifelong learning, that starts internally and then it spreads or expands when we are in a culture where it is expected that we are engaging in lifelong learning. So, what does that look like? Number one, it looks like funding that is provided for us to engage in these faculty development opportunities where we are attending conferences and we're bringing back the information that we've learned and sharing it with our peers. Second of all, it looks like us receiving additional compensation for the advancements that we have been able to publish or engage in, such as a certification as a nurse educator or achieving our CHESI. And when we see that there's an opportunity, even if it's included as part of our promotion criteria, it's going to create more value for us as individuals and also, again, for our nursing education culture. Another really important component of Malcolm Knowles' adult learning theory is us being self directed in taking advantage of the learning opportunities, of the advancement opportunities. Everyone's journey looks a little different. Our ability to really advocate for ourselves and to develop a roadmap to success is going to help us feel like we have more satisfaction in our role. And then when we're able to partner with our leadership team to make sure that there's compensation, advancement opportunities for promotion, then we're going to even feel more value for the impact, not only that we're making in the classroom, but there's going to be more of a financial incentive as well, which is always a positive thing. All right, so this is going to conclude our snapshot. We want you to recap. First of all, what was your one learning takeaway, okay, before we wrap up with our thought-provoking question correct option? And then second of all, we want you to think about what are your next steps on your journey? Are you already enrolled in the self-paced course? Have you figured out what your best learning style is? This is going to help you ensure that you're aligning a plan that is going to be most successful for you. All right, so stay tuned and we will share the answer to our thought-provoking question. All right, so the correct option is going to be B. Okay, so if you chose B, give yourself a round of applause. Collaborate with non-nursing disciplines to develop shared curricula. Now, this was on that lowest level when you think about Bloom's taxonomy, because there was only one option that really talked about collaborating, right, outside of the nursing discipline. And we know that's what interprofessional education or interprofessional collaboration really is centered on, our ability to work well together, that socialization aspect, with other healthcare professionals to provide the best patient care possible, right? We all contribute when it comes to making decisions about what is best and what is aligned with our nursing practice standards. And there's also value that we get from our other colleagues, whether it's allied health, pharmacy, nutrition team. We all want to work together to ensure that our patient outcomes are the best that they can be. All right, so why are A and C not correct? Well, first, let's talk about the collaborative curriculum development and how important that is. This is going to help ensure that our nursing students stay engaged in meaningful collaboration with our peers from other disciplines. This is going to align with NLN's focus on fostering collaboration and competency in interprofessional collaboration. Options A and C do not adequately address the comprehensive nature of IPE. So should we align our accreditation standards with our curriculum? Absolutely. Should we integrate lecture-based delivery content? Yes, we know there's a role for pedagogy. Remember, pedagogy, you can think about PED, the first three letters. That's more aligned with K through 12 learning, where we are giving information to our learners. We are seen as that content expert, that sole content expert, and we want to make sure that we are aligning our content in our lecture with the evidence, right? But we know there's a role for pedagogy as well as andragogy for our adult learners. However, A and C really don't have anything to do with the question, right? So that is why B is going to be the best option. It's not that A and C are not good statements, because they are. However, they don't best answer the question for what we're presented. They're not the best option. All right, so if you did not choose the correct answer, here's what I want you to remember. First and foremost, we don't write answers for the NLN exam, right? So we don't want you to get stuck if you did not choose the correct answer. And we want you to think about what gap area did you discern from the thought-provoking question? That's the exact purpose of the thought-provoking question. We want you to consider the correct option and the rationale for those incorrect options. So you can go back, you can clarify any muddy points that you have by reviewing the content in Billings and Halstead. Chapter 1 is where we're focusing our content today. But when you go back, especially if you're in our self-paced course, go and look at competency 1 and 2. After you review that content, if you still have questions or you're unsure, reach out to us, info@drsellarseducate.com. We hope that this snapshot has been helpful, and we look forward to seeing you in the next one. Have a great one, everybody.